For those of you who don't know, if we have not met, my name is Amanda Wicker Newton, and I am one of the co-founders of Facette Medical Spa and the Hair Experience. And I am usually behind the scenes, but on our nights of anniversary, I get the wonderful, I guess it's a privilege really, of being hostess of our nights of demos and sharing with you. It gives us the opportunity with so many different people to show you behind the spa door what happens, get up and close and personal, and you can ask all the questions that you may want to ask. That makes it a little bit easier instead of trying to fit 70 people into one room. We can't do that. So this has been an amazing time to be able to do that and share. It's such a fun time for me to be able to be a part of this, and we have a great time together. Hi, Barbara. It's good to see you. Tonight, we are going to be talking about, pull out my handy dandy schedule. I brought my glasses tonight too last night. All of us girls were struggling to read the paper. We didn't have our glasses with us, but we're going to be talking about injectables. We're going to be talking about CoolSculpting and Cooltone, hair restoration, hormones, peptides, peels, calligraphy cut, makeup and skincare. It is going to be a fun night of great things. I want to just go over a few details. Please, please, please use the chat in here. It is going to be a really helpful tool this whole entire night. If you have questions, it helps me ask the questions of what you're wondering of the providers. A lot of times I can know what that looks like, but sometimes it's helpful if you just type in here. Plus, it's a great interaction to be able to interact with everyone since we're all muted, which allows us the ability to have a good conversation, and you're getting the best opportunity up close and personal with the demos, but still engaging with everyone in our little Facette community for the evening, which is fun. Throughout the night, I will be doing lots of giveaways. You do not want to miss that. That's my favorite part, is the giveaways. Okay, I love all the parts, but I do love doing the giveaways because that is super fun for me. I have in my room with me, I have Miss Madeline. She is my helper, has been my helper all week, just making sure that I have all the things so that we can do that. But in that chat, she will be putting in our team's Instagram account if you want to check out their Instagram and go see any of their work there or see something continual. She'll be posting the promo information there. What other things did we post? Oh, I have some other things. So anything that we might have will be posted in there. So you can look for that as well. So you will be able to have that direct access right away to that. Someone asked earlier, how do we see the ones from each night before? Probably tomorrow, I would say you'll be able to see, hopefully Tuesdays is up. I need to go and look. I can have Madeline go look for me, but on our YouTube account, on Facette's YouTube is where we put all of our videos from the whole entire week. We love that you want to maybe go back and watch or share with a friend, whatever that looks like. We put that out there. So those will be up and available. And then tomorrow night is our in-person happy hour. It is from 5 to 7 here at Facette, and we will have light bites, of course, some champagne, sparkling water too, for those of you who are doing all the dry things. And we're gonna just have a lot of fun. A big grand prize, the big grand prize here that I have sitting here, let me show you. This whole basket full of all the things, including Coach designer sunglasses and all sorts of full-size products, over $3,000 worth of products and services in this one package goes to one person who is in person on Friday night. So it is worth the trip in, and we won't keep you too late, but definitely a good time. And it gives us a chance to really just be able to give you a hug and celebrate with you, because without you, the last 6 years would not have been possible. And you all are what make Facette possible and are a part of our community, our little Facette family. And we love that so, so much. So we're excited. Without further ado, I feel like we should get going on the demos for tonight. So let me pull up our next one. Thought I had everything. I think we're actually set to go. We are here in the beginning with, we've got Carrie, Erin, and Jessica, and we're talking about injectables. There she is. Hi, Miss Carrie.
Hi, Amanda.
How are you?
I'm great. I'm great. Great introduction. We're so excited to have another night with our Facette community.
I know it's going to be a good night. So let's talk injectables. Tell us all the things.
Wonderful. I'll start again.
Mm-mm. Uh-oh, we lost you. Hang on. I need you to unmute on the fib. Oh, there we go.
There we go. Okay, now are we good?
We're good.
Okay, perfect. I'll start that again.
Thank you.
My name is Carrie. I'm a master nurse injector here at Facette. I'm amongst one of an amazing team of injectors. They include Amina, Jessica, and Erin. The first one we're going to be with is Erin, and she is going to be doing a traditional hyaluronic acid injectable called KISS by Galderma in the lips of our beautiful model, Chimera. She's started already with the lip injections just to get started, but we'll zoom in and see what she's doing. So people oftentimes ask who is a candidate for injectables, who's a candidate for lips. Um, I would say anyone that wants to add hydration,
Mhm.
wants to add a little bit of volume, wants to add a little bit of lift to their lips. So really anyone is a candidate for injectables in the lips, but that's not, of course, the only place that we do injectables. We have dermal fillers that are appropriate for all areas of the face. As we age, we know that we lose volume in our face. We also have descent, so things start to drop and sag. So fillers are great for adding light volume. They're great for adding lift. They're also great for adding hydration, anywhere from mid face to lower face and around the mouth to give us a very natural and youthful look to our face. Fillers are great for that. Most fillers last anywhere from a year to a couple of years, depending on the placement of the filler, the amount of filler, and the type of dermal filler that we use.
And it's, you guys can see Chimera has a little tool there that she has on her chin, and that just is like a little vibration tool that helps just distract from what we know is happening. We know there's needles for those of us who are a little bit nervous, but also we have all the things that make you comfortable. We use numbing. There's actually lidocaine in the most of the fillers. And
Mhm.
if you are a little nervous, we can still do a little of the Pronox, you know, that just helps take that edge off. I think, Carrie, one of the what I hear, right? One of the biggest misconceptions is that, like, if we're gonna do lip filler or filler really in general, it's going to give an unnatural look. Like, we're gonna go from
Yeah.
0 to I look completely different, like Pat Boland's wife, or you know what I'm saying? But and that's so much more than just what we're talking about tonight. This is just a way to enhance the shape like of your already beautiful lips and like you said, feel more hydrated. This filler is amazing because it has movement technology, so it moves with your mouth. I mean, I think, don't you think that's one of the things is that people feel like it's
Yes,
so
absolutely
dramatic?
agree.
Yeah.
Yeah, I think unfortunately sometimes the misconception, excuse me, is that, if we use a dermal filler, we're going to look fake, we're going to look overdone. That is not our goal at Facette, and that's not the goal of a filler as well, as we really want to um, give you again a natural look, some hydration. We want to give you a very soft look when we do this. I think our goal is always to make someone feel like they're refreshed, revived a little bit, but never ever overdone. We want to enhance contouring in the face. We
Mhm.
want to give lift. We want to give hydration. Like I said, with lips, sometimes it's about giving some beautiful definition to the lips. And that's the goal, something that is more natural, that makes you feel a little bit more rejuvenated.
Yeah, or even balanced. I mean, one of the things is that, I mean, all of our bodies are unique and we're different. Some of us, right, our balance is a little bit off or symmetrical, and it helps just balance those things out and just adds an extra little boost of beauty.
Yeah, yeah, especially as we age, things start to change. As I said, sometimes we lose a little bit of definition. So adding a little bit of contour or a little bit of lift, those little slight changes can make a really big difference in how we look and how we feel about ourselves, which not only for women, but for men as well. I do
Absolutely.
want to note, and thank you, Amanda, for bringing up that we do a lot of things to make our clients more comfortable, topical numbing. Of course, there's lidocaine, like I said, in the product. We've got a facial stimulator that's a nice distraction. We've got, little squeezy balls in the room that also help, ice packs. And then we do have things for post-care that help as well. I want to mention, because I absolutely love this product. One of our lines is called Elastin. We have a product called Enhance, which is a post-injection serum that really helps minimize bruising, because there's always that risk with injectables that there might be a bruise. Other things that we can help with that, of course, are light stim LED lamp that helps reduce swelling, and ice, of course, helps with that as well. But we always have lots of tools in our tool chest to help with recovery so that it's a smooth transition back to having that beautiful lip back without some little bit of bruising.
Yeah, I think we also know that we have a team member or two who might sing a little to distract you, so
Yes, yes,
we will,
Erin,
we'll do
Erin
anything it
for sure
takes.
is yeah, yeah, she's got the voice of an angel.
Yeah, we have a good time for sure.
Absolutely.
Uh,
I'll mention one of the things, since we are talking about lips in this room, and I'll mention again, we've got, dermal fillers for all areas of the body, but we also have a SkinCeuticals antioxidant lip repair. We live in such a dry climate, so anything that can enhance moisture to our lips, we love. So check that product out as well. And just a reminder, our products are 20% off this week, so it's a great time to try something new.
it
I think
is.
we're ready to go next door. Is that right, Amanda? And
Yeah,
see
we're
our
ready.
next one. All
Bye.
right. I'm so excited. Thanks, Erin and Kamara, our beautiful model. So as we go next door, I'm excited. This is Jessica. Jessica is in this room with her beautiful model, Erin, and they are doing Sculptra. Sculptra is also an injectable, but different than your traditional hyaluronic acid fillers in that it is made out of polylactic acid. Polylactic acid is a stimulant for collagen. So we're injecting polylactic acid. We mix it with sterile water so that we can actually get the PLLA into the tissue. And then over time, we start to see a stimulation of this collagen. Again, you'll ask, okay, so who is a candidate for Sculptra? Really anyone that is going through the aging process. We start to see again a little bit of volume loss. We can also see the descent or gravitation starting to pull us down. And Sculptra is beautiful for that light volume, that light lifting. And the best part, we call it here the Sculptra Glow. Sculptra Glow meaning we have this beautiful shine to our skin. We see a firming of the skin. We see beautiful tightening and texture that improves with Sculptra. So you get kind of a triple fold when it comes to Sculptra, which Jessica and I will high five that this is definitely one of our favorite products. We love all of our products and they all have important needs for sure. But Sculptra for sure is a beautiful product for the aging face, which we all get, right, over
Yeah.
time.
Well,
So Jessica's using, I'm just going to mention, she's going to use a combination of needles and cannulas. People oftentimes say, what is a cannula? A needle, of course, is sharp. A cannula is dull. It's like having a little tiny straw. The point behind that is in hopes of having a little less bruising, and finding that we're getting into some different layers of tissue with it. So we use all the tools in our toolbox to give our clients the absolute best outcome.
I love that. And Sculptra, I mean, we have it as a filler, but
Correct.
really builds, it's a little different because it helps build over time.
Yeah, we call that a biostimulator, right?
Yeah.
So if you think about our skin, and our tissue, and our face as a mattress, and as we age, that mattress starts to deflate, right? So the coils aren't as strong, that top pad starts to kind of wear out. Sculptra is really helping us rebuild those coils and really structurally give the mattress that nice firmness again. And so we love that it stimulates that and builds that over time. Sculptra will last you about 2.5 years. And just like everything, with our fillers, they're going to last anywhere from a year to a couple of years. Sculptra is going to last you a couple of years, but there's always going to be some maintenance. So we continue to age, we continue to lose some volume. So building a good foundation and then just having some gentle maintenance kind of helps us maintain that more youthful appearance with our skin. And everyone's different, so a consultation is going to be really important. We want to meet with you, we want to see you, we want to talk about your concerns, we want to talk about what your goals are, and then we're going to write up a treatment plan, and we're going to find something that works great for you. And then what does that look like over time, because we want to take care of you for years to come and make sure that we maintain that beautiful youthful look that you're looking for.
Absolutely. And with Sculptra, Kiri, about how quickly, right, can we see results? That's always, and everybody's different, but we start seeing
Yep.
results at, a certain mark, and
Yeah.
we
So the
continued.
uniqueness about Sculptra too is that, again, we dilute it with sterile water, excuse me. So initially we put it in, you have that fullness look and you're like, wow, this looks amazing. And then about 48 hours later, you're like, what happened to it? So you're calling Jessica and you're going, I looked good for 2 days and now I don't look
Right
good.
away.
We say, don't worry. You're building that collagen. So over the next 12 weeks, you start to see that lifting, that gentle volume kind of coming up nice and slow. And then again, you just keep enhancing that over time. So you're going to notice a difference at 4 weeks. At 12 weeks is really going to when you're going to see that glow. We're going to move you back so
Yeah.
you can see Jessica now do the massaging piece of Sculptra. Sculptra has a little homework with it. We send you home with some instructions. We call it the rule of fives. You're going to do a gentle massage for 5 days, 5 times a day. And you want to, again, think of that PLLA as this little seed. And we're going to make sure that we spread it around and then we lift the tissue right where we want it to stay. Now, of course, after we've just poked you with some needles, having a massage at the end is pretty lovely. This is the best part. You get to lay back and just let you feel great for a minute.
Yeah. And the providers are so great. Honestly, if you even have just questions about like, oh, I want to know all the things, come in and have a consult. They are complimentary. We want you to come in. Make sure you ask the questions, spend the time, understand exactly what the pre-care, the post-care, whatever those things are. If you know you want to come in and have a consult and you're thinking, I still want to have a treatment that day, just let guest services know. We can book it that way as well. Our goal is to make sure that we create the correct treatment plan, just like Carrie said, for you and what your goals are. And that is, that's the most important, is it's your goals, and we can get you there, whatever
Absolutely.
avenue
Absolutely.
it is.
Yeah. Yeah. Just a shout out to our injectable team here. Amanda, they're, as you know, they're amazing.
Yeah.
They're incredible women that are incredibly skilled, highly educated.
Yep.
And our goals are keep you safe, listen to you, um, create amazing treatment plans, excuse me, that have great outcomes. And that is our goal for you. So we would love to meet and see you if we haven't already.
Yes. Thank you so much, Carrie. Appreciate it.
Thank you.
Yes. I will say too, we are as a team very education forward, and our goal is to make sure our team has all the tools that they need to bring the best treatments to you. And it's even incredible. This week is it is a lot that we ask of our team during anniversary week, because we have long days and late nights and events. I mean, it is packed full, and we have a lot of fun, but it's a lot of extra. And we had the opportunity to take advantage of one of the top trainers for Allergan, which is one of the products that brings us Botox and Juvederm and some of these products here. And the team, without a doubt, was like, yep, let's have that person here, and was training again this week in the middle of all of this to have even more education. And our hair team has another training on Sunday to make sure that they're bringing the best to you as well. So we love that part of our culture. And when people ask me about Facette, it was important to us that education is a big piece of what we do, and why we can bring you and your goals the best. They spend so much time educating themselves to take care of you. And I think it's what sets them apart, truly and honestly. So I just wanted to share that with you, because it's an important piece, I feel like, of who we are at Facette and why we do what we do. All right, now we have oh, there's my friend Erin. Hi, Erin.
Hi, can
How
you
are
hear me?
you? I can hear
Oh,
you.
good. Yes, I am wonderful. And I have my glasses on tonight, so I
I
can
know.
actually.
Mine are sitting right here. I'll put them on. So we'll be the glasses sisters right now, but you might see like my ring light. It's fine. Last
Yeah.
night we were like, can you read that? I can't read that. And the lights were
Well, I
great.
didn't want
God.
to,
We
I
were
didn't
so
want everybody
funny.
to not be able to see my beautiful lashes that I had.
I know your lashes were amazing. Last night we were at the fun event and lots of lashes. You know, the lashes were such a huge hit last night, huh, Erin, that we have
They were
decided
so fun.
that for Friday night, we're adding a lash bar. So you can come have lashes for Friday night. And Taylor's like, I'm young, I don't need glasses, but we can have lashes. So that will be super exciting. And we're looking forward to that. So that is going to
I'm
be
really
fun.
excited for this next part that we're about to talk
Me
about.
too.
So let's get on to
Ready
talking
for
about
that?
some
We're
cool
going to
stuff.
talk about Cooltone. So let me share my screen. All right, friends. This is where I'm a little nervous for the night, but it's going to be fine. All right, there you are, Miss Erin.
Woohoo.
All right. All right, Erin, why don't you share about what we're seeing as we go through Cooltone?
Will do. So right now she's filling out some paperwork.
I know paperwork is really important.
So let's talk a little bit about Cooltone. So what Cooltone is magnetic muscle stimulation. So what it's actually doing is it is bypassing your nervous system so that it can actually contract at a very high rate onto that muscle and get it to develop. So what Cooltone does is it actually tone strengthens and firms muscle, and it is fabulous way to get that muscle going. And either for, say you want to go on vacation, it's great for that. But the greatest thing, what I love, it is really great for therapeutic things as well.
Yeah.
So people who may have had an injury in the past, or have maybe some limitations such as MS, or if they've or in a wheelchair and they may not be able to use those muscles. This is a great way to get those muscles activated and moving.
Yeah, I have arthritis. I shared that the other night when we were talking about our CBD line that is so amazing. And Erin has helped me with this treatment because my joints really struggle. And this has been amazing because there's some movements I'm not able to do anymore because of my joints, that it keeps those muscles strengthened and then has actually made my joints feel better. And so it's so incredible that we have that capability. What areas are we able to treat with Cooltone?
So right now it is FDA approved for your abdomen, your glutes, your quads, and your hamstrings.
Who to
So
quads?
yeah, so
Oh yeah,
and
you
it's
can
just a
see.
great procedure. So how it works is think about when you go to the gym. Think about when you go to the gym and you're doing as heavy as you possibly can. Well, this one is like going to the gym for 2 hours, doing your maximum muscle contracture every single time. So it is just kicking your muscles bootay.
Yeah, and you can see right now in the video, hopefully everybody can see exactly what we're seeing. You can
Yeah.
see even the muscles contracting. And they do some short pulses and some long pulses. It is it's a cool treatment. It's not very long, right? 20 to 30 minutes per area.
Yep. And you actually start to see results. So how it works is your initial treatment is initially 4. So you do 2 treatments 1 week, and then you come back the next week and it's 2 more visits. And we break them up about 2 days apart, just to give your muscles a little break. I saw that Elisa asked, are you sore the next day? You can be, but sometimes you're not as well, because a lot of times what happens is this really bypasses that area that causes all the soreness. So that's pretty cool.
Yeah, and
Your lactic acid. I couldn't think of the word lactic acid. Sorry.
I mean, why? I'm just kidding. No, it really, I mean, like some soreness, but not like you said, it, I think it's just a very dynamic treatment. And, obviously men or women, any contraindications, Erin?
Yes, with this one, it is because it is a magnet. So, of course, always number 1, if you're pregnant, I'm sorry, we cannot treat you. Number 2, if you have a trochlear implant or if you have a pacemaker. Also, if you're a female and you have a copper IUD, we can't do your abdomen. If you have a regular birth control IUD, such as like the Mirena, that's totally okay. It's just that copper, because that copper, it's a magnet and it can get pretty hot. We don't want to get that area hot.
No, no, that would not be good.
Yeah, so those are really the contraindications
Yeah.
for this one.
Which is not a lot. And so if you have questions about it, come in, you can meet with us, have a complimentary consultation. Let's find out if, if it's going to help you get to the goals that you want to. What other treatments go along with this treatment? Are we ready to move along?
We are. And I just wanted to say with the Cooltone though, it is really one of Amanda and I's favorite treatment. So if you have any questions about this, or even if you're like thinking about, oh, I want to go on vacation and this is fabulous, or I want to step this up to help my fitness goals, this is a great way to do this. It's more of it's a complementary to working out. So it's kind of like, think of, going to the gym. If you all of a sudden stop going to the gym, you're going to lose your benefits. Same thing. So this is kind of giving you that leg up, and then you continue going to the gym and eating healthy, and you're going to see these results last a lot longer.
And I feel like it adds to it. I mean,
Oh, for sure.
obviously you're incredibly fit. We all know Erin's our little fit girl. And, even when she did the treatment, we look at those pictures, it just enhances what those things already are. I was just thinking, my gosh, I should be doing my booty right now while we're doing Zoom booty. Just kidding. That might be inappropriate, but it'd be fun because we got to get it done. But it is, and I like that it's not a super long treatment either. So.
And a lot of men really love this one. So.
Men love it. They love it. Absolutely. And because really there's only so much you can do before your body fatigues. So it's great to have that extra asset.
Yeah. Let's talk about what's next.
We're gonna talk about CoolSculpting. So why don't you give us do you want to give a prelude, or do we want to watch our little video testimony?
Well, I'll give you a little slight one. So CoolSculpting is the #1 non-invasive fat reduction, actually in pretty much, well, definitely in the United States, because you can do this treatment and then you can actually, if you want to go back to work, say if you want to go to the gym, you absolutely can. It works through what's called cryolipolysis, which means freezing fat cells. And how that actually works is these two amazing doctors from, of course, Harvard came up and decided or researched and found out that at a certain temperature for a certain amount of time, you can actually freeze fat cells without hurting the muscles and the nerves of your body. And at that, what happens is once they freeze and they die, our body's little macrophages go in there and act like little Pac-Man, and they eat those dead fat cells. And then our body just eliminates them. So you can actually start to see results in about 4 weeks, but it really takes up to 5 months to see your results from one treatment. We usually 98% of the population needs 2 treatments, and we consider that your treatment. The soonest you can come back is 6 weeks after your first treatment to get your second treatment done. And then again, those procedures, those fat cells that are already dead are not going to be affected. It's only going to affect the ones that are still alive. You can expect to see up to 25% result in your first treatment and 25% of fat cell reduction in your second. So we're talking 50% here.
I was just gonna say, that's 50% fat
Mhm.
reduction.
Yeah, it's
And
amazing. It's a fabulous treatment.
it's huge.
Yeah.
We were talking the other night that, as we age, it's just a reality. We gain fat in places we don't want it, and we lose fat in the places we need it. And we're trying to balance everything back out.
Yeah.
And but it really is an amazing treatment. What I love, are you ready for the testimony?
Yes.
Okay, what I love about what we're sharing tonight is that, we do these demos each year with our anniversary, and we love that we get to do them because we see amazing results, and we get to, we get to treat right then and there. And so the testimony that we have for you tonight is from our model, who was our demo model last year. And I've known Becky for a long time. And one of my favorite things in the midst of this was that she came to me and said, that was the best thing ever, because I actually love how my legs look now. And I've known her for long enough to know that that was an area that she really struggled with. And so we want to share her journey throughout this whole year. So it's not just what's happening tonight and what you can see on the screen, but what has happened over the last 12 months of this. So let me share my screen again, try and get everything up for you guys. I have a lot of videos tonight, which means that holding on, nope, wrong one. Oh, please. Here we go. All right, meet my good friend and our model from last year, Becky.
My name is Becky Zell, and I've been coming to Facette ever since it opened. The longevity of the staff service side, and then with the addition of Facette hair, it was a done deal for me to come here. I come to both the spa side as well as Facette hair. I have had facials, I have had filler, I've had Botox, CoolSculpting, I've done the LED bed. Over the past 6 years, I've been more comfortable coming to get spa services done with knowing the staff and their professionalism and the care they have for their patients. It was a no-brainer for me to come here and to just be taken care of. My goal was always to look natural as I age, and this has been the perfect place for me to do that. My 2 favorite treatments at Facette Spa have been the Botox as well as CoolSculpting. I happen to have been born with some extra love handles around my thighs, and it's something as an active woman that I've never been able to get rid of. So I've been challenged with outfits that I wear, being comfortable, feeling confident, and the CoolSculpting has completely changed that. It's been challenging because I've done all the things with eating clean, exercising, staying active, and it never resulted in a smoother look on my thighs. So I wanted to stay away from a surgical procedure because of the downtime that it would take. I have a very busy life. I have children, I own 2 businesses, and I just can't have the downtime. So CoolSculpting allowed me to have a procedure within 1 day, and I was back to work the next day. Thank you, Facette, for being so caring and taking such good care of me over all of the years that you've been doing and helping me with different procedures to help me just age gracefully. Thank you for giving me my confidence back.
I love
I
that
just love that so much.
so much. And so it's so great to see from start to finish, you know, how it dramatically changed her and her perception. And she really, I mean, like I said, I've known her for a long time. She really is incredibly active, works out a lot. And we all have areas, all of us have areas on our body that we're just born that way, that just store fat. And we were able to really shape that for her. We were, I had been working on some photos, but I have to be honest, they did not upload correctly. So I don't have that. But what we will do is find a way to share that and share that with you to show the difference between that. The difference between CoolSculpting and Cooltone, Erin, right? Cooltone works with the muscle, CoolSculpting works with the fat. So CoolSculpting takes away fat, Cooltone
Tone strengthens and
strengthens,
firms muscle.
firms muscle.
Yes.
That's the difference.
Yeah. And the great thing with CoolSculpting is, well, it really is a sculpting procedure. So if you, especially, you know, I see a lot of mommies who have had children and maybe they've had C-sections. Those darn C-section scars, they cause so much, you know, damage down in their abdomen area. Now, we love our babies. We love that what our bodies have done for us, but sometimes it can cause that little bit of a lip. This is the best procedure to kind of get rid of that.
Yeah.
It is also, you know, great for gentlemen as well, who have those problem areas like in their flank areas around, you know, their love handles, as we like to call them. But the places that you can actually do CoolSculpting, it's pretty fantastic. You can do under your chin. So if you have that double chin, we can actually do under the arms. We can do bra fat. We can do back fat. We can do your abdomen. We can do your flanks. We can do your outer thighs. We can do your inner thighs, and we can do your knees. So
CoolSculpting shuffle now.
it's really, I know. It really is such a great procedure. And the best thing is, guys, there is no downtime. There is no surgical anything with this. You do this treatment, you go home. You don't have to tell your husband if you don't wanna. I mean, it just is such a fabulous procedure. And guess what? The best part is it works.
It does work.
It works. It is the #1 treatment for fat reduction, non-invasive. There's a reason that Allergan bought CoolSculpting for $1 billion.
There is a reason for that. And the promo that we have this week and this week only, everybody's like head, shoulders, knees and toes, knees and toes. Truly is the best deal that we ever offer on CoolSculpting, which
Incredible.
is, you know, 50% off the original price for 6 or more cycles. As you heard from Erin, we typically need to do more than once per area. So that really gives you an area of treatment and can get you to your goals and your success. And that's what we're wanting to do, is get as many people there as possible. And I mean, we're all very busy. I mean, the fact is that we love that we don't have any downtime for what that looks like. So anyway, anything else you want to share about our body shaping, Miss Erin?
I think we did such a great job. But if anybody has any questions, please feel free to message, and I would love to get back with you. Also, you know, we offer complimentary consultations. So if you have, you know, if you think that you are interested in this and you want to know if you're a candidate, come on in. Carrie and I are your CoolSculpting providers here, and we would love to take care of you and treat you and see if you're a possible candidate for this amazing procedure.
Yeah, and they're so great. And they do comprehensive whole body. We want to really have a conversation about what are your needs, and let's talk about what that is. And if it's not gonna work, we're gonna actually have that conversation. There's no need to do something that isn't necessary for what you need. So this was awesome. And we're so grateful for Becky sharing her story from last year and
Yes.
just the incredible transformation. Like I said, that was an area that I know was a huge struggle. And so to see her be almost teary, like, I like my legs, was incredible. So love that. Thank you, Miss Erin.
You're welcome. Thank you, everybody.
All right, we'll see you soon.
Okay.
I love so much. Thank you, Miss, I think it was Anne. Thank you, Anne, for reminding me that a part of this week that we do is we partner with a nonprofit every year. And the nonprofit that we have partnered with this year is the Bree Foundation, or Beauty Renewed. And every we give a donation back from all of our proceeds this week in a way to help them grow. We did an interview with them on Tuesday that you can see on YouTube when that is showing, but also the link is in the chat that any donation that you donate $5 or more, your name goes into the drawing for all of our prizes. We have our grand prize on Friday, but we are going to give away prizes for those of you who are here tonight, which we'll probably do here soon. And then also at the very end of the week, we give another $20,000 worth of prizes away. So it's absolutely positively worth that space, and we'll get their names from there. So now we are going to go to, okay, where are we at? Oh, we're talking hair restoration with Miss Mina. Hi, Mina.
Hello, how are you?
I'm good. I'm all over the place with all the like videos and all the things. I'm trying to be, you know,
No, it's been
Miss
a
Tech
lot.
Girl
So
tonight.
I am here with Miss Sheila and Jenny, and we are laughing. Sorry, we've been a little bit, it's been a long week. We've had an amazing fun week, but we're all a little tired. So we are kind of cracking up and, you know, getting a little flustered. So here we are. And
Yes.
now we are talking about Carolase, and we brought this treatment on about a year ago, and it's been really successful. And we're so super excited to be able to share it with you guys tonight. And so what Carolase is, it's a laser treatment, as you can see, and then it's growth factors. So what Jenny is doing with Miss Sheila is that she is doing these, creating these like little micro channels. So the laser heat is so fine and so light because we don't want inflammation. Like when we're building collagen, we want lots of inflammation because that stimulates the collagen. But with this treatment, what we want to do is just these fine little micro channels open up that dermis just a little bit. That way, when we do the topical growth factor, that it'll really absorb in. And our growth factor, which was again designed by Carolase, and so it has 8 different growth factors in it, and it really absorbs really nicely after we create these microchannels. And so Jenny is almost done with the treatment itself, and then what she's going to do is put an LED light on Sheila's head, and it just lasts for about 10 minutes, and it absorbs in really, really nicely. And so what we've seen with this treatment, what they've seen with studies, is that it's really about 38% hair growth is what you're going to get. And you're going to get also, so you get quite a bit more hair growth, but then also the hair follicles and the hair themselves actually get thicker. And so if you're somebody like me who has naturally kind of fine hair and kind of fragile hair, we actually get about 60 to over 110% in diameter of each individual hair, which is great. And so who is a candidate for this would be somebody really, a lot of times, you know, men, as men lose, not we, I'm not a man, but as men lose hair as they get older, they're great for it, right? So as they get that kind of thinning here or thinning in the back of their head, that's a great treatment for them. For women, we also lose hair. And so that's a lot of things that we don't talk about a lot. But as we go through perimenopause and postmenopausal, then we start to thin out too. And we start to get that kind of widow's peak here. A lot of women get thin all the way through the top. And so it's a beautiful treatment for that, kind of stopping that and regrowing that hair. And then again, thickening that hair. So now Jenny, what she's doing, she's putting on that topical. And if somebody has alopecia, which is an autoimmune where they lose hair, may or may not be a good treatment for them, just depends on the person. So if they've really lost all the hair on their body, it's probably not a great candidate for this, but if they have some patches of thinning, then they really actually could be a great treatment for that type of person who's just had a little bit of thinning or a little bit of patchiness in their hair follicles and their hair. Did this hurt at all, Sheila?
Not at all.
No. So Sheila's been super comfortable. Like we say, we were giggling before we got on camera. And so she was having the laser done and giggling with it. So what the series of treatments is we want to do a series of 6 treatments. Now, we all know the frustrating thing about hair is it's not instant, right? We love Botox, we love fillers because they're instant or almost instant. And so that's what's really great about them. We all get that kind of gratification on that. Hair takes a while. And so we do a series of 6 treatments and they are separated out about 1 month apart. And so we do like to purchase it in a package of 6. And then usually by about treatment number 3 is when I've seen my clients start to get really good results. I've done it on a couple women who had significant hair loss with babies. And so every time they get pregnant, they had 2 or 3 babies like really close together. And every time they get pregnant, they get hair during the pregnancy and they lose significant hair afterwards. So they've had great success with it. I've also had a client that had great success that had shock hair loss. So we know that sometimes when you have anesthesia or if you have to have multiple surgeries in a short time span, then you can get that shock hair loss. And because of just the medications in your body and the shock to your body of having surgery. So that client had a significant amount of hair loss. And it was so great to see her when she came back in for her 3rd, 4th treatment. And I could just significantly see, I'm like, if you came in today, I don't think you'd be a candidate for this. That's how much more hair growth she had. So it's a really cool treatment. The other neat thing about it is, so Jenny just put in the topical growth factor, and now she's going to put that LED light on. And we're just going to sit, I think it's for about 6 minutes or so. So it doesn't last very long. And then we're going to send Sheila home with some products at home. And so that was a good sentence, wasn't it, guys? And so with this one, so we got the Carafactor shampoo and conditioner, and it just stimulates the scalp, which is great. And people really love it. Even women love it, this product. And so even if you have you're like, oh, I only use this shampoo and this conditioner, which I totally understand because I'm on that bandwagon too. But the Carafactor I've used in my own scalp, and it gives you this nice tingling sensation. And you can use that and then your own shampoo after it and your own conditioner. And then we also have the growth factor that's take home as well too. So you're going to use that once or twice a day for the entire month after your treatment. And then when you come back in the next time, then you're going to get all new products as well too. So that's all included in the package. And we've just had great success with it. So we're really super happy with this treatment.
Yeah, it's incredible. I have actually done the treatment. I started my treatment a year ago. I did the 6 sessions and then I've done some continued maintenance. I tend to have hair loss because of my thyroid and getting older and those things. And definitely, I mean, Taylor has done my hair, and there was at that 3-month mark, like I was having it look like static, right? All my baby hair is sticking up, and it's been amazing to see just the hair growth come in, and especially the areas that I have like more like patchy and what that looks like. It feels a little bit like a sunburn afterwards, kind of like you would say, like your scalp stayed in the sun just a little bit, just a little warm, but then it's gone. The other thing I really love about the serum, Mina, is that you use it every day, even when your hair is dry, and it doesn't make your hair gummy or weird or anything like that. Like I still would put it in every day on my scalp and I rub it in, and I do my hair as normal and no issues. So it's a great treatment. You get your monthly supply of all the things that you need for this to be successful. And we've just been really grateful to see some good results because there's been a lot of hair loss.
There's a lot of hair loss, and I had some hair loss like after I got COVID. And so there's lots of different reasons, hormones, like you said, thyroid, sicknesses, surgeries, just getting older. There's a lot of reasons for hair loss. And I think everybody or almost everybody struggles with it to some degree. Yeah. The other thing I would add on to that is I do feel like hair is kind of multifactorial. So it's great to get the laser treatment and do the at-home topical products that we have for you. The other thing is the oral component. So on the hair side, we do sell, and I always pronounce it wrong, but it's neutral foil, FOL.
Yes.
So so that has a topical as well for kind of maintenance, and then it has oral supplementation, which I think is so great. We've had a lot of success on that, and so I'm excited that we actually brought that on, and we can complement both of these together.
Yeah, and we talked about that a little bit in the panel on Tuesday, that what's great about
Yeah.
the Nutrafol is that it's not just one product for everybody, right? There's one that's for women, one for men, one that's for stress, one that's for more,
Yes.
so it really, and Mina, you and I were talking, we saw a friend of ours who
We did.
he's in the laser world.
Yeah.
And we were like, what'd you do to your hair? What treatment are you doing? And it really came down to, he added the Nutrafol and it really made a difference on top of the other treatments, the laser treatments that he had done, and his hair looked amazing. So
It
really
did. It
a
was
great
really
add-on.
thick. I was
Really good.
Yes.
We were
I
really
was super
shocked.
surprised.
Yeah.
Mhm.
So,
Yeah. Yeah. Especially for a
that.
middle-aged man.
Oh, he's not on here, so we're not going to talk about that. Okay. All right. Thank you, ladies, so much.
Yes. Thank you.
The package, I think, Madeline put that in here, and it is a 6-pack because we want you to do the 6 treatments, which are, one a month every like 30 days for that 6 months. It's really important because of the hair growth cycle, and that hair growth cycle is what we have to make sure that we're getting all in that space. And you get all of the products and the Nutrafol, the 3 months of Nutrafol. It is absolutely amazing. So this is a great, great treatment, and we could not share that tonight. So super excited about that. We are going to talk about some next exciting things, but you guys, I have to stop for just a second and the team will have to wait because I have so many giveaways for the night. If I wait till the end of the night, it's going to take forever. So I have to give some giveaways right now. So one of the things that we talked about early on, I know I love the giveaways. It's my favorite, is Kiss. Kiss is the #1 filler for lips in the United States. And just a little tidbit for you, Facette is the #1 provider of Kiss in our area. So I love that we are on the top end of that. So Debbie McCune, we have a syringe of Kiss for your lips if you want that. We also have an elastin bag that has that post injection serum and a couple other things, and that goes to Alicia Anderson. So we're excited to share that with you. We have, this is a big one, you guys. CoolSculpting treatment of 2 cycles that we're giving away tonight right now. And that is over $1,600 worth of a gift to do. Drum roll, please. Oh, I love it. Yeah, I know. I need, you know what? Next year I'm gonna need like a little like push button of like sounds because I don't make the sounds. My husband, he makes all the sounds, but and that goes to Tiffany Dinsmore. So if you guys hear this, we put this on your account that we make this note. You can come in and get your consultation. We can have all the discussions with you about that. So congratulations, Tiffany. That's a big one. Elastin Transform, we didn't get a chance to talk about that, Erin and I, yet, but it is one of our favorite products. It is, and she'll be back on here, I think, in a little bit. We can talk about it a little bit more. But Transform is a product that we utilize that helps our cells prepare for treatments that we do. And we see amazing results with it. It goes along great with any of the body treatments. And so that goes to Jonathan Caulfield. So whoever's signed in under Jonathan, that is for you. Yes, Tiffany, congratulations. I have some Nutrafol collagen, which is a product that Nutrafol puts out. It is their collagen powder that goes along with all the things we're talking. Collagen is amazing for hair, nails, skin. That goes to Carrie Bauer. My gosh, it's so amazing. I'm going to save that one because we're going to talk about that a little bit. And we're going to wait on the others. We're going to wait because those are coming up. So we're super excited. Congratulations, Carrie. You're very welcome. All right. Now I need to find, Miss Molly just joined us. Hi, Molly. I need to find where Miss Kathy is. Sorry, guys. Sometimes it takes me a hot second. Erin, are you on there?
Yeah, Kathy's here.
Hang
you
on one second. I'm trying to find you. I lost you.
Oh no,
How did that happen?
find me.
I know. Hang on.
People are there on here.
deal. Just lost all my stuff. Sorry, guys, give me 1 second. Everything. Just. Usually it's in order. Oh, there you are. I found you. I put you in a place that I was supposed to have you in the first place.
You put me in the corner.
No, nobody puts Aaron in the corner. All right. Hi, Miss Kathy.
Hello,
How are you?
I'm great, thank you.
Good. We are so excited. Let me introduce everyone. This is Kathy. She is our PA here at Facette and an amazing addition to the Facette tribe. She is our bioidentical hormone specialist. And Kathy even went to an additional training just to become that specialist. And so we're going to talk a little bit about hormones and peptide weight loss, because we know that that's a huge subject right now that we want to talk about. So, Kath, I think what I want to do really quickly is share the video of our hormone testimonials.
Mhm.
So we can watch that. You guys, I'm losing all my things. But let me find it. Hang on 1 second.
My name is Becky Zell, and I've been coming to the Facette ever since it opened.
My screen just changed on me, of course. Imagine that. Madeline's gonna have to come help me. I found it. Yeah, I got it. All right, here we go.
I started going to Lauren about 5 years ago when you first opened. When I walked by to leave every day, I noticed the spa and I thought I knew Carrie from a previous place where she did skin. So I knew she was really good and I decided to come back to her. I believe I came for was to do some derms on my face, wrinkles and acne. My husband, I talked him into coming and getting the hormonal growth pellets, and turn 50, you start feeling some female things that are going on. So I came here to see if the pellets would help with the hot flashes and kind of the mood swings, and I had no energy, and that's really started to help with all that so far.
You know, I didn't think that I actually felt that bad, right? I mean, you slow down, you're less active, you have less energy, sleep's not as good as it was, and it's just part of aging, right? That was my assumption. I knew very little about pellet replacement therapy or testosterone replacement therapy, and I was skeptical at first. When you see results, you're almost envious more than anything else. And so I'd seen the results with Julie, and the natural progression was for me to jump in and try it myself. As I said, I was skeptical, so I went through one cycle of the hormone replacement, and when I came back, I actually said, hey, tell me this isn't just a placebo. And because you don't feel much the first couple of times, really. The first question that was asked me was, well, how do your joints feel? And I'm like, I never actually thought about it, but my joints didn't ache at all, even just after one cycle of it. And that was the piece more than anything else that hooked me. The easy answer is, right, as you get older, you lose your sex drive, right? Mm-hmm. That's the easy answer, right? And that's why I think most people come in more than anything else, because of the lack of testosterone, especially in males. With us not being as irritable, right? Obviously, we get along much better, right? My sex drive is better. I'm not going to speak for her. Okay? It allows us to do some things together that we might not do together. We're in the gym together more often now. You know, we weren't in the gym before together. I think with Julie, and I don't know if maybe I shouldn't speak out of turn, but she has now become more obsessed with weight training, where she wasn't a weight trainer before, right? She was more cardio. But I think you can really see a difference in her body because of the testosterone. And she's not big and bulky by any means, right? And that's the fear of most people, is like, well, I can't get on testosterone, right? Because it's going to make me big and bulky as a female. And that's not the case. Pretty much what he said. So I can tell when it's time for me to come back in for my next shot, because I'm getting to be tired and brain fog is starting to come in. So it's really helped to remind me to get back in here about every 3 to 4 months. I recommend coming and trying it and giving it a year, and to come see if it does the benefits it's helped me. Say Dr. Kathy Robinson. She is very easy to talk to. Any problem, or she's awesome at getting back to me, and I feel very comfortable with her and trust her a lot. So
Oh, I love that so much. And we felt like it was super important it was great to share the couple because obviously it made a difference for her. So then, why not have it make a difference for him? And that's what we see, Kathy, right? The most important is trying to get us to all feel better. And I think the biggest misconception is that, okay, we're aging, so we just have to accept it. So hot flashes and feeling crappy and gaining weight, you just have to deal with it. And that's not true, is it?
It is not true.
It is not true. What would you share, Kath, about, your experience as you walk through this process with each of our clients? The biggest thing is changes in just how they feel.
Yeah, it's different for everyone. That's something that we all have to remember. Some people feel amazing right away. They come back and tell their friends it changed their life. I tell them don't say that, because sometimes it's a little more gradual for people, but I just work with them until, we get to where people want to be.
Right. Well, our hormones just don't overnight one day just change. For some of us, I guess they
Right.
can, but it really does. And it takes a minute to find the right dose for each of us, or our dose can change, or stress, or all of those things can change. And I think what I love so much, that has been a huge benefit to me, Kathy has made a huge impact in my own health journey, is that I love that you listen to how we feel. You take that into consideration. It's not just about numbers or averages. It's about how do you feel and what does your body need based on your circumstances. And I appreciate that so much, but I feel like that's how we even come at this whole thing in our world of like what this looks like. Don't you agree? It's about how you feel.
Yeah, that's really important. I don't like to rely on labs too much, because if you just stick with numbers, then you're discounting,
A
different
huge piece
people.
of it. Absolutely.
So I go more by how people feel than anything else.
Absolutely. Now, we do have a process. So, and I think that's important to explain that we do have a process where we get labs. So it gives us an idea of where things are and we can address those things. We absolutely address hormones and thyroid together. And then we look at the labs and you have a full consultation with Kathy, talk about all the things that you need to address to feel better. And then start a treatment plan from there and start working through what makes you feel your best. We may readdress, we may retest labs just to get a good gauge and what that looks like. One of my favorite things that made sense with Kathy was she said, well, you're feeling really good. Let's get your labs now so that we know where your numbers are when you feel good. And I was like, oh, that's so smart, right? Why wouldn't, usually it's like, oh, something's off. So we try and get our labs, and trying to determine what's off now, if you don't know where it feels good, is a huge piece of what that looks like. What would you want to share with anyone else about, and you obviously went to additional training for just hormones because it became so important to you. Why did it become so important to you?
It makes people feel good. And there's a lot of misconceptions about hormones.
Yeah.
Like, obviously, estrogen causes me to gain weight. I don't want any. Well, actually, the loss of estrogen causes you to gain weight.
Yep.
Or, for instance, males think, oh, testosterone is going to give me a heart attack. Well, guess what? The studies prove otherwise. So.
Well, and they've even shown that optimizing testosterone levels at a healthier long-term level and not letting it get too low has preventative benefits for all.
Yeah, it helps get rid of that visceral fat in there. People are more motivated. They get motivation to exercise.
Yep.
So they take care of themselves better.
Absolutely. I will say, those of us here at Facette that are of that age, I personally, I will speak for myself. I do hormone replacement therapy. I was doing hormone replacement therapy years before, and then I had a hysterectomy 3 years ago, and it made a huge difference in my sleep, in my energy, in my ability to handle stress. We kind of tease each other around here like, oh, we know who's due for hormones. They're a little cranky. No, but we become irritable when we don't feel good or we're not sleeping good, you guys. We're being honest. And so those things are important. I love that we saw a couple, because I also think it's important that obviously in your relationship, he brought up sex drive, and I was like, we tease about the sex drive because it's an easy one to talk about, that it does impact that. But the reason why is because when that decreases, we just start not feeling like ourselves. And whether that's sex drive or energy or sleep or moodiness, Kathy and I, one of the things that for me, I don't tend to be a very anxious person. I can pretty much carry the weight of the world the most of the time. And all of a sudden I'm like, Kathy, I'm really anxious. Something doesn't feel right. And my estrogen, because my one ovary was dying off, that started making me feel that way. And we figured out it was a hormone imbalance. So it can really impact you in a lot of different ways. And it's just finding ways to make you feel better about yourself. And that's an important piece of what the hormones are. Will you just share a little bit, Kath, about how we do bioidentical hormones, which is through hormone pellet therapy, and what that process looks like before we talk about other things?
Yes, so hormone pellets are bioidentical. All that means is when they break down in your body, the molecules they break down to are exactly like what's in your own body, so you don't have an allergic reaction. They're also transdermal, not oral, so they don't go through the first pass of the liver, so you are not at risk for a blood clot. So basically what we do once we get your numbers and your goals, we numb you up, make a small, like 3 millimeter incision, and insert those pellets into the subcutaneous fat. What your body does is form blood vessels around them. So within 2 weeks, blood's constantly flowing over the pellets. When you're sleeping, less blood. When you're stressed out, exercising, that's the main thing. Yeah, your body can use.
Yeah, they're bioavailable, so you can use them when you need them and not just topically or ingesting them and they're high and then low and all the things. One of the questions was, what would be the benefit of a woman who's turning 40 to do hormone therapy, getting blood work, and starting kind of that process?
So if she's premenopausal, it's going to help her focus and concentration. When she works out, she'll actually see a difference. She'll actually see that she's building muscle. It'll also, again, help with the motivation, decrease in visceral fat.
Yep.
Yeah, brain fog's a big one.
Oh, brain fog is huge.
When they come in, they can't even talk sometimes because, the hormones are so low. I understand that.
That's a good question. So the question that came up is from Libby, and she says, is this something that can help with high cortisol levels?
That one I'd have to address separately.
Yeah. Okay, we're addressing that separately, which means it's probably something more specific. I think the other thing that I appreciate so much about Kathy is that if something comes up and it's a question that she doesn't know the answer to, or maybe it needs to be addressed further, she will do all of the research and make sure that it's addressed in the medical way. And I appreciate that so much because sometimes we're all very unique, and poor Kathy, I'm the most I have a lot of things. So it's great that we can do that. And so I think that's awesome. What I want to do before we go into peptides, because I feel like that's a whole nother extra thing that we're going to do. I want to introduce to you guys Tress. And oh, I love that. Lisa Lovely just said, Kathy has helped me get my life back. And Rebecca, this would be a great, does it interact with hormonal birth control? No, all of those things will be addressed in that consultation where you can find out exactly what will work for you or with you, depending on those things. So we can make sure that we address that for you. I want to introduce, I'm going to add a pin here to you, Tressa. This is Tressa. Are you unmuted, Miss Tressa? Hi. This is Miss Tressa, and I'm gonna have her share a little bit about her story. But last month, what we decided was hormone therapy to talk about in a demo is a little bit unique, right? We could talk about labs and numbers and all these things and how we feel. But what we thought would be incredible would be to take someone with us on a hormone and peptide journey. And we knew that Tressa had some challenges where she wasn't feeling quite like herself, and we asked her if she'd be willing to go on this journey with us. So we're taking Tressa on the Facette hormone and peptide journey starting in January. And she's going to be doing, she's already come in, she's done her lab work and met with Kathy and had her hormone insertion. She's going to be doing hormones and also our compounded peptide weight loss therapy. And we're going to be doing this for the next 6 months, and we're going to take you with us, and she's going to be sharing all of her story. And we're going to continue to share on our social media. So tell us, Tressa, a little bit about you and why this was something you wanted to join and start with us and share with the Facette community, but also how you're feeling now.
Sure. I think typical for most women struggle with weight loss, especially I'm 50 and I felt just a plateau, even though I eat really clean, I work out 6 days a week. I just was not feeling or seeing any changes. I did have a hysterectomy 4 years ago, and the loss of sleep, irritability, brain fog, all of those things were compounding my everyday life. And I didn't realize that I was premenopausal until I came in and did the blood work with Dr. Kathy. And I was kind of shocked because I thought, oh, I still have one ovary. I'm okay. But I really wasn't. The levels were really indicating what I was missing. I can tell after that first injection of my hormones, within 2 weeks, I felt great. I was sleeping better. I had more energy. I got a B12 shot, which made a huge difference. So truly, within those 2 weeks, what a difference. And I thought, why didn't I do this sooner? As far as the weight loss, I'm never going to be tiny. I don't want to be tiny. But there are some levels of areas that no matter how much working out or calorie reduction, I'm just not going to see that. And so I do feel that the weight loss will help along with eating clean and working out. And I'm anxious to see what that's going to look like. I've only done 2 injectables, or injections. So not that
We're
far
going to
yet.
talk a little bit more about the peptide program and how that works, but I love that you've gotten started. And I think what I love the most is that we're not just doing one or the other. We could do, testimonials on just hormones, which we did, and we could do just on peptides, which we could do. But I love that this is going to be a full journey for you, and we get to be on the journey with you, which is a very intimate and personal and vulnerable journey that you've allowed us to join you on. So thank you so much for that, because that's really special that you're allowing us into that space. But I love that you're already feeling better, which means we're in a good spot to get started and going. And Tressa's another one who has already been very active in her life and has a busy life, and no matter what you were doing, and I've been there too, wasn't able to lose weight. Hormones impact that. And there's a myriad of other things, but just a little bit of weight loss, whatever the goal is, if it's 5, 50, whatever that looks like, to get us to a place that we feel a little bit better, really does make an impact and helps our health. And I think that's the biggest thing, because I feel like weight loss can just be about how we look, and how we look does help us feel better. But truthfully, it's the inside piece of heart health and organ health that makes a big difference. So it's going to be a fun journey, and we wanted to introduce Tressa to you because this is the beginning. Obviously, it's only been a few weeks that we've started this, but we're going to continue to watch her journey. This isn't going to end. And next year at this time, when we come back on with Kathy, we're going to talk about how the whole year went and what changes there were, and we're going to be able to follow her entire journey about what that looks like. Is there anything else you would want to share about all the things, Tressa?
No, I've been with Facette since the conception, and so I get
You have.
various things done, and I just love it. It's just such a wonderful medical spa and hair experience, and we don't have anything like it in North Colorado, to me. And so I'm just grateful. I'm grateful for the friendships that I've made. And I love to come in and see the girls and always find out the new products. So definitely thank you for what you're doing. Keep it up. And thank you for this opportunity.
No, thank you. We're so excited. And you should go check out the chat. Everybody's just saying how beautiful you are. And so thank you so much for allowing us into your journey, because it is a special one, and we're excited to follow along and see your huge success. So thank you, Tressa.
Thank you.
All right, have a good night. I wanted to share, we just a little behind schedule, sorry, because I think we're, in a different space, but I wanted to share a little bit about we lost Miss Kathy, but I want to share a little bit about our peptide weight loss program. And so with that is a compounded weight loss injection that is done once a week. It is semaglutide, which is what you probably have heard on the media that is known by Ozempic. And the thing is there's some big misconceptions around it, in my opinion, but also there's some incredible results that happen with it. And what it does is it's a GLP-1 antagonist, which means it slows down your gastric emptying, so you feel fuller longer. It also helps regulate your insulin, so how our body utilizes insulin. And so allowing us to not feel like we're working harder. As we age, as we go through perimenopause, as we're in menopause, I mean, really, I'm in menopause and it's hard. You can do all of the right things and your body fights you. And that's what Tressa was dealing with, was doing all these right things, eating correctly, meal prepping, working out on her Peloton, and still not able to lose any weight. And that is so frustrating and defeating and discouraging. I know many of you have seen my journey over the last year and seen that, I have lost some weight, and I was utilizing the peptide because I had PCOS very young, which is polycystic ovary syndrome, which makes you insulin resistant. And then going through all of these other things, and I started some medication that changed my biologic makeup that made it hard for me to lose weight. And this just allowed me the opportunity to have my body be in check and make it work for me instead of working against me in that space. And I love it's something that we offer here at Facette. We were one of the first ones to be able to offer the peptide weight loss. If you have questions about it, please come in and have a complimentary consultation with Kathy. It's worth asking all the questions. You don't have to tell anybody what you're doing. We had a gal come in and share that, she shared she was interested in it and her friends were really discouraging of her. And for her, she'd been really fighting her body for a long time and needed something to help her, and watching her feel more like herself has been absolutely incredible as well. So know that we offer that. If you have questions, you can reach out to me as well. I'm happy to share my experience with it and what that has gone on to do as well. But we offer that as well. And it's a part of our whole, wellness piece. We say Facette is total beauty, total wellness, and that is definitely our wellness piece. So I will get off of my little soapbox, the peptide soapbox, because we had to do that. And we are going to go to Miss Kim. And we're going to talk about peels. Hi,
Hello.
Kim.
How's it going?
Good. How are you?
I'm doing great. It's
I
been so much
love-
fun. This whole week has been a great week. So
It has been a great week. Thank you so much for all your sharing and all your hard work. It means so much. And I love your red lip. Every sassy tonight. I love it. I have always said, Kim, that I feel like peels are very like, what's the right word I'm looking for, but almost like the unsung hero, right? I think they
Yes.
can be really like undervalued, and
Yep, they kind of get ignored a little bit. Yes, they're great. And there's so many people that are candidates for them too. So we have such a broad spectrum of what we can offer within peels, but basically anyone is a candidate for peels. There's just so many different options with it, but we would assess your skin and determine based on your Fitzpatrick, which is your skin color, what would be one of the best fits for you, as well as what conditions you're trying to treat. If you're looking at anti-aging, if you're looking at treating acne, blemishes, sun damage, those types of things are all going to play a role in how we decide which avenue to take. But when we do that, when we're doing peels, we're looking at basically a deeper exfoliating process than what you can do at home. It helps reduce the appearance of different things like your blemishes, like I mentioned. It helps smooth the skin's texture, improve the overall radiance of your skin, and it restores things back to a healthier skin type overall. It enhances the cell turnover as well to improve that appearance of your skin and brighten everything up.
Absolutely. I think another misconception about peels, because we call them peels, right?
Mhm.
Is that any peel that you do, your skin is gonna shed off like a
Right.
lizard, right?
Right.
And you're gonna just all these, but that's not the truth. There are some peels, like we
No.
have a peel that I love so much that is like a red carpet peel, we would call it, that you could do right before an event and your skin is just glowing and fresh and radiant because it's a perfect amount of exfoliation and even helps with hydration. So will you just address, like, we could go
Yeah.
from 0 to like your skin comes all the way
Exactly.
up.
So there's a range of solution types we can pick from. And so within that, we have like your more advanced peels, which are going to cause a little more sloughing, a little bit more downtime, but we also have your more superficial peels.
Yeah.
And those are going to be the ones that you want for your red carpet. They're the ones that are the night before go and glow kind of a thing when you're getting together on a first date or going out with the girls. So within that, we've got the AHAs and we've got BHAs. AHAs are our alpha hydroxys. Those are going to be our peels for anti-aging, fine lines, wrinkles, dullness, sun damage, hyperpigmentation, those types of problems. While our BHAs are beta hydroxy acids, and those are going to address more of the problematic skin that are acne based and maybe enlarged pores and help bring that kind of thing down.
Yeah.
We also have deeper peels like our TCA. And that's one that's going to be a little bit more advanced signs of aging and not so much your girls' night out option.
No, you're gonna have, what's our downtime with TCA? Let's be honest, right? You're gonna shed, maybe flaky. There's gonna be some skin that feels a little tight.
Right.
So what?
Right. So if we're looking at a peel that's more like our TCA, you're going to be at about day 3 when your skin starts to look a little bronzed and almost like you got a tan. You'll start out red and then it goes to that by day 3. And that's at the point where things will start to get a little tight and want to slough. And typically they start peeling periorally first, and then it works its way back into the hairline. So that's one of the types of peels that you would want to plan for. You wouldn't want to have family photos the next day.
Yeah. They were asking about, I'm just gonna share it on here and Madeline's gonna put it up for me. They were asking about any peel deals for promos. We have the carbon laser peel, which is a laser peel, but we're talking actual peels. And what we do with our peel promotions on a daily is such a great promotion that it's just what we offer on a daily, and we just are going to highlight it this week to share that it's something we offer. But we do a custom package of peels that's $100 off of 3. And the reason we do it that way is because you may not need 3 of the TCA that Kim was just talking about, where we're going to shed all the things, but we might do a TCA and then something a little bit more medium that dresses maybe more discoloration, and then something a little lighter. So it creates the opportunity for our
the right path for you. So we can customize even within our peel types. So we can start with a TCA, because most people don't need a TCA, but maybe once or twice a year.
Yeah.
And then after that, you can do something that's a little more superficial to maintain the results you get from those bigger guns, bigger, more powerful types of peels.
Yeah. But we can create the perfect treatment plan for you. And I feel like peels are, yes, custom-made. I love that peels are great in between lasers too. Like, it's something that you can combine with other treatments. It doesn't just have to be a standalone. It can be a part of a treatment plan. They just are really such a broad spectrum of treatment. Now that we talk about it, I get excited because I like the peels. I'm gonna need you to peel my face off when I get back from my vacation. That's what we'll have to do.
I know one of our favorite things to do too is to dual exfoliate with these peels.
Yes.
So we like to combine them with our dermaplaning, with our microderm, and then we come over the top with one like our sensitive peel, our micro peel. Sensitive is a great one. We can then give you that really good glow, and you just get to go on into your day looking fantastic.
Yes, and not everybody can do a dual exfoliation. You have to be a medical clinic to be able to do that because of the level of depth that it goes to. So it is something that we get to offer here that we love, that we can, because it's an amazing treatment. It's one of my favorites. I have a lot of favorites, I guess.
It's one, if you're somebody who typically does dermaplaning and every now and then you're like, oh, I kind of want to bump this up a notch, we can add that on and just enhance that whole process.
Absolutely. And it's worth it. If you haven't tried it, this is a perfect opportunity to be like, okay, I have done dermaplaning and I do it consistently. I feel like there's sometimes I want something more. This is exactly what to add.
Yep, exactly.
Okay, any other thing that you'd be like, okay, you have to know this about peels before we go.
Honestly, don't be afraid of them because
love
they
that.
really are something that majority of people can do and go right back to life. So don't hesitate to ask about them. They are probably more for you than you think.
Yeah, I agree with you. And less scary. I love that.
Yeah.
Thank
Yep.
you so much, Kim, for sharing and sharing your
Yeah.
knowledge. Always, you guys have been amazing and I appreciate you.
Hey, I'm looking forward to the rest of the week and see everybody tomorrow night.
Okay, see you then. Oh, I love it. Our team is so amazing. All right, before we go on to the next thing, I'm gonna do some giveaways. I have a long list of all the giveaways. All right, one of the things we didn't get a chance to talk about was something new that we have added, which is NAD. Do not ask me to say that whole name of what it is. It's a long name. It is a shot that we do subcutaneous, so like in the fat, super easy, but it is all about cellular rejuvenation. So I know we have information on the website about it, and it is immunity, cellular rejuvenation. It's amazing for skin. I started reading up on it for my immunity, especially going into the season, and have been I added it. Actually, you guys know the first time I added it was last year before anniversary week. I got sick, really sick, and I was like, I'm not sure I can host all week long. How am I going to do this? And I got an IV and she introduced me to NAD, and it dramatically changed how I felt over the weekend. So I started doing more research, but it is something that we offer here, and super excited that we can offer it here. So if you want to know more about it, ask our team over the next couple of days and we'll tell you about it. But we're giving away an NAD shot, and that is going to Deb Compost. So congratulations, Deb. Yes, Jenna, you'll be able to purchase products tomorrow, products and services at the open house. Part of that is so you can come in and ask questions of us and talk with the team, and they can do some, oh, thank you so much. See, she found it for me. See, I'm not gonna say that. I've tried to say it a million times. I'm not gonna do it. It'll be horrible. That you can ask those questions, and we can do a little consult with you, and you can, get those things, and we can find the right package for you here at the open house. We probably won't do any scheduling that night because scheduling takes a little bit more time when we're looking at your schedule and our schedule. So we will be able to purchase products, services. You can get our new robes. You guys, those robes, I'll have Malin go grab a robe so I can show you those amazing robes that I'm madly in love with again. But Deb, you get that. And then micro peel. We're giving away a micro peel, and that goes to Lisa Lovely. Congratulations, Lisa. That's exciting. And I have a SkinCeuticals discoloration kit for Lauren McGee. So congratulations, Lauren. That is for you. And then I have an Elastin moisturizer, which is one of our favorite our favorite lines. If you heard Aaron and I talking about Elastin last night, that goes to Olive Thompson. So congratulations, ladies. These are the new wrap-up robes by VIP. This is the one called Blue Hawaii. It's really beautiful. They are a USA-based company that these robes are really in the most luxurious places like Ritz-Carlton, Four Seasons, names that you would recognize as top brands. And now at Facette. Oh, I love this one. This is one of the most favorite ones of the Facette team. You can see this beautiful, I feel like it has tropical vibes. This fabric feels like silk and satin microfiber it's just amazing. And it washes so incredible. It is absolutely amazing. So something we wanted to introduce this week as something new, and we were excited about that. Okay, let me check out any messages. All right, now we are going to go to, I need to find my other girls here, Miss Michelle. And hello. Hi, friend.
Hi,
How are you?
I'm great. How are you?
Good. we are going to talk about Calligraphy Cut, and we're so excited because Nichelle is a calligraphy artist and she is a gold artist, which is only one of how many in the United States?
I don't know
A
the exact
handful?
number actually, but
Like a
yeah.
hand, it's a very small amount because of the amount that she has done. And we're excited because the calligraphy team is back in action and in the United States, and they're going to be here this weekend helping Michelle's going to be there training with them and certifying the rest of our team for calligraphy. It is a game-changing tool that we love. Do you want to share a little bit about calligraphy, or do you want to watch the video first?
No, I definitely think we should talk about it before we watch the video, just so everybody has a little bit of an idea.
Agreed.
So calligraphy is a tool that was created in Germany. I actually have it right here with me. I'm wearing black and the new pin is black. I went
Ooh,
to
yeah.
California this weekend to help them launch. And they gave us new pins because they have a third edition pin. So this is what it looks like. Hopefully you guys can see.
Yeah.
And they're basically the thing that makes calligraphy do what it does is there's two specific angles in the tool. One is a 3-degree angle, and what that does is it basically cuts the hair perfectly without compromising the integrity of the strand. So it's pretty much the same angle as if you were to cut a pill with a pill cutter, so you didn't break it into multiple pieces. It's the same thing. As soon as it hits the hair, it doesn't compromise that hair integrity when it puts pressure on the hair. So you get the healthiest haircut for the hair. And they've done tons of studies on this. They've used microscopes, they've blown up images, so it has definitely been tested. And then the second angle that is in the tool is the 21-degree angle. And that basically is cutting every single hair like you would a flower. So when we cut flowers and we put them in water, it allows them to absorb more moisture and live longer. That was like the inspiration behind calligraphy. So that is what the tool is designed to do, is cut our hair in little flower cuts, and our products can penetrate deeper. And it also makes almost every single hair almost 3 times larger. It's 270% larger at the base. So not only do you get the healthiest, you get the most bang for every strand to be at its full potential of like thickness basically. And you get more volume, more movement, and the healthiest cut for the hair. So it's super exciting. There was a couple of models tonight that you guys saw, Becky and Tressa, and both of those lovely ladies are my clients and do calligraphy cut. So it gives you a little bit of versatility of what can be done with it. You can do really blunt cuts with internal layering, or you can do really fun, layered cuts for volume and movement. So there's a lot of versatility in it also.
I love that. I feel like it, obviously we're gonna, because of how it cuts the hair, absorb more of the moisture from the treatments that we do and the benefits of that, but also you're cutting more of the style into the hair because of how it cuts the hairs almost individually. So then you cut the drying time. I mean, there's so many benefits to calligraphy that just are an amazing game changer. I feel like the biggest misconception, Nichelle, is that calligraphy cut is a specific hairstyle when really it's a tool we use to create a perfect hairstyle, right? It's not a specific cut,
Yeah,
it's more this tool that designs the hair.
Yeah.
Ooh, I like that.
Yeah, your hairstylist is like your hairstylist is, I'm getting a list. Your hairstylist, their way of doing hair is going to stay the same. It's just a different tool that we can use to customize your haircut. So like Amanda was saying, you can definitely manipulate the hair strand to do, to basically style the hair into the directions that you want it to. So if you have hair that grows towards your face and you want it to go away from your face, there's ways to help it be encouraged to go in those ways. If you have a bob, it's great for basically pushing the hair into the ways that you want it to lay. So yeah, definitely. It is not like a specific one cut where you're all walking out with the same cut. It is just a fantastic tool that we can use to customize your haircut and get into the areas of your hair that we couldn't normally get with our shears. And it's not going to do what a razor does to your hair, because a razor makes your hair thinner and doesn't always necessarily make your ends healthier. I don't want to like speak negatively to those tools because they benefit us and we can create beautiful styles with those also, but it definitely just it's engineered to do something different. So
Right.
it's not comparable.
So Jenna was asking on here, like it can cut the hair in half, but it also cuts at an angle. It really cuts the end of the hair, right, at the angle, which is what's creating the base of the hair. So think of the hair straight, it's going to cut the hair at an angle here, but because of how it cuts the hair, where if you were to look at like what other tools could do, it could cut like the hair in half this way as opposed to like cutting this piece of it. So the way it cuts it individually means we can give it some movement and thin it out without really taking out too much of the hair. And Jen, I know Jenna is one of our curly hair girls on, and calligraphy is beautiful for curly hair. It creates such movement and bounce for it. And how it works is absolutely super incredible. Let's watch. Are you ready to watch the video? I want to do that.
Yes.
I have to move. All my stuff got moved around, Michelle. Hang on, sorry. I hit a wrong button somewhere. And now I'm trying to navigate it all. So let me find our calligraphy video.
Oh, I lost the video.
No, it's because I'm pulling it up. Hang on one second.
Oh,
I started
okay.
going to Laura. Less active.
See, I have to find the right one. Hold, please. This is what was happening today where everything got a little lost for me. All right, here we are. Here's Miss Nichelle. Can you see it, Nichelle?
Yes, perfect. So this is my lovely client, Mandy. And right now we're just greeting her, showing you guys the lovely space that we have. So as you can see, when Mandy came in, her hair was super long and didn't have much of a shape to it. She was just kind of letting it grow. And we were chatting about what we wanted to do with her hair. She showed me a picture of this really cute collarbone, like very voluminous, kind of almost edgy-ish kind of layered look that had a lot of texture. Right now it's showing you a Fusio dose. That is the treatment that you always get complimentary with your calligraphy cut. We are a Kerastase salon, so we have about 30 different options of in-salon treatments that work instantly the second that they hit the hair that we use in your service. So you can have moisture, repair, shine, color protecting. We have one called Genesis that's great for strengthening. So there's lots of different options depending on the type of hair you have and the things that you need. So yeah, basically right now I'm just kind of parting things out in here and getting the hair ready.
Look
So
how
as you
cool
can
it is
see-
though too. I have to just say, Nichelle, like I love watching you and the team use the calligraphy pen because it's beautiful to watch you cut hair with it. Like it's a beautiful tool, just the way you even use it.
Oh, well, thanks. Yeah, so it's kind of cool. As you guys can see, when you are cutting the hair, it looks like you're writing. So hence that's where the name calligraphy came from. And you don't see any crazy things in the haircut other than like the fact that it's a different tool. It's not like you're going to get a crazy different experience other than the fact that it's going to feel a little bit like little massages all of your head when you feel the hair getting hit by each, you're giving more individual attention to each strand, basically.
Yeah, you feel it a little more like at the base of your hair. It's kind of interesting when it just feels a little different.
Yeah, in the beginning, when I first started doing calligraphy, everybody was saying that it almost felt like I was cutting closer to their scalp than I was. And I had to reassure them, like, don't worry, that's not happening. But yeah, so right now, this is a really cool technique. This is something I can do that we can do to put in like underlying volume under the hair. And there's so many different cool texturizing techniques that you can do with calligraphy. So right then I was kind of doing that underneath just to help give her a little bit more oomph and a little bit more sass to the hair. And it's something that you wouldn't really, it might look scary when you're doing it, but then after you're like, oh, that's not actually that scary. It just kind of helped. And so then I'm just kind of blow drying her out, showing a lot of volume. If you guys want lots of volume, you want to blow dry the hair in the opposite direction of the way that it goes, or that it falls.
All right, Nichelle,
And
the question is, does it work with fine hair? I mean, really,
yes.
the tool was created.
Yeah, when I first got educated in it, actually, they were pitching it as a fine hair cutting tool. And they were saying that that was the best for fine hair. And then the more we got to use it, we realized it's actually great for all hair types. You just need to know which techniques to use on which type of hair. Not every hair needs the same technique. So like Mandy, she actually has fine hair. So it was really great for her to show so much more like volume and movement in the hair and
The
get it
haircut is
just
so cute.
thanks. And getting it. She's adorable. Love
It's a
her.
beautiful haircut. What a transformation. I mean, she had that longer hair, but such beautiful transformation. Libby asked, does it thin hair? It really, like, because I have very fine hair too. Nichelle has cut my hair before in the past. I have very fine hair, some very interesting spots sometimes that can be challenging to work with. And you can give movement to the hair without thinning out the hair.
Totally. And so the answer to her question
hair.
is, it doesn't have to thin out your hair. We have techniques that we can use for people who have too much hair to take out weight and not compromise the silhouette of the hair. But if that's something that you're concerned about, just let your service provider know. I get really freaked out when my hair is being thinned. So please don't do that. And we are in complete control of what techniques that we can use on your hair. So if you ever do get something done with the tool that you're like, that was like not my favorite. It's always okay to come back in and give us like feedback and say, I loved what it did for my hair for movement, softness, volume, but I didn't love the layering. I didn't love that you took out weight. And then we can just adjust and put notes in your file and make sure that we don't do that again. So yeah, we definitely, it's all more in our control. I don't want you guys to ever think it's the tool that's done a disservice to you. It's just what might be a miss in the consultation or something like that. So it's very good to know that if you have anxieties around things, just to let your service provider know the things that you're comfortable letting happen in your hair and the things that you don't want. So
yeah, Mandy, she said, it doesn't feel thinner. I'm also noticing less hair shed, like minimal in the shower. Like she's feeling really great in that space. And the haircut is beautiful. Like it was a beautiful transformation. Nichelle's an amazing artist, just like the rest of the team. Obviously, so great in that cut. Anything else you want to share about calligraphy? We're very excited to be hosting them this weekend. They're finally back in person. We haven't done that since COVID.
yeah,
And the team, we're certifying more of our team. Oh my gosh, I'm so excited.
that was all I was going to say was that soon every provider in here will be able to offer the service, which is super exciting that we get to grow that and offer our team that. And yeah, I mean, if you trust your service provider and you want to try something new, I will be excited that we'll be able to offer that to you in all of the chairs soon. So that would pretty much be my biggest thing. And just to try it if you haven't. It never hurts to try something new. And you can always go back if it's not something that you're a fan of, but it's very unique and it's not even in every state in America yet. So it's right here in Fort Collins, ready for you guys.
That's
so.
exactly right. I love to, one of the things that we do here at Facette, obviously because of how it cuts the hair and it creates that base, you know, increases it by 200%, so you can absorb more of the nutrition that when you do a calligraphy cut here at Facette, you get a complimentary Fusio dose. We were talking about the Fusio doses with the hair panel on Tuesday, where they can customize this treatment that impacts your hair, and that Fusio dose is $38, but that's complimentary when you do a calligraphy cut here at Facette, and that is a wonderful package that we get to offer to you.
Yeah.
So, and all your clients are giving you lots of love in the chat. So thank you.
I love that. Love you guys.
Thank you so much for sharing. We appreciate it very, very much. All right. We're so excited. Thank you all for hanging in there with us. I know that we are a little behind where we thought we would be, but that's okay, because the most important is being able to share with you all the things that we want to share with you. I have some giveaways, you know, have a few of those. I like the giveaways. Let me find who I'm supposed to find for our next one first. I think they might need a minute to get transitioned, which is just fine. Oh, there they are. We're gonna actually, we'll go ahead and I'm gonna give away all the prizes here in a second. So I need I think Miss Lauren is on the phone. We need to turn the phone so we can see Madison and Faith correctly. There we go. Oh, there we go. Well, we went round. We went right around. Like that was a whole thing. That was amazing. I love it. Hello, Faith and Madison.
Hello.
How are you, ladies?
Good, how are you?
We are good. What do you have to share with us tonight?
We have so many fun things to share with you tonight. I'm sure as you all can tell, I look a little weird with half of my face done, but that's a portion of what we're talking about. Tonight we are going to be talking about skincare, makeup, and I will be showing you guys how to do a basic smoky eye and how to apply lashes on yourself because that is its own different ball game. So
It's a whole different ball game. Putting lashes on yourself is completely different than someone putting them on you. But if you want someone
absolutely.
to put them on you, that you can come have them put on you for free tomorrow night at our event, which is exciting. So share with us all the things, Miss Faith.
So just to kind of start, I have Miss Madison with me here. She's an esthetician, and we want to talk a little bit about the importance of skincare before makeup. So Madison, what is the importance? Like, how important is skincare before makeup?
Well, to be honest, your skin is your foundation. You know, if you feel like your skin is
Faith, get closer to her.
or it's not holding up, it's not holding up your foundation or whatever your powder is going to be using, your makeup just doesn't feel like it's right, you know?
Yeah.
So your skin needs to be clean and well hydrated, and you need to have that good base foundation to hold up all of your makeup.
What is like a good, what products would you recommend for hydration when it comes to that?
So, to be honest, there's so many of them, it's hard to pick. My favorite products are actually a combo. I love the B5 hydrator. That's really going to hold water to your skin, which is really important for like maturing skin so that it can help plump up those fine lines or, really prep it so that the makeup is so nice on it. My next favorite product is the triple lipid. We are all in Colorado and it is so unbelievably dry here. And the triple lipid is really going to help your skin stay hydrated and not that flaky, gross feeling that you feel in the middle of the winter.
Absolutely.
It's especially important in Colorado because we're dry all the time. And triple lipid is amazing because of how it puts like those the cholesterols and the fatty acids, all the things that we need back in our skin without overdoing it. Just back in there. When we're dehydrated, we look a little rough. That's for sure.
Absolutely. And what about sunscreen?
Oh, okay. Sunscreen. As an esthetician, this is our holy grail. I will stand on this hilltop until I die. But we need sunscreen. All skin types need sunscreen and sun protection. We are at such a high altitude that the sun is beating down on us always. So my favorite one actually is one of our tinted mineral sunscreens. Are you wearing it?
I am. That is actually what my base of my makeup is. I'm not wearing any foundation tonight, you guys. I am wearing the Alaskan tinted sunscreen as my foundation.
And I think all of us can. I think I'm wearing it today. We can all preach.
The team love it. It's one of our favorite for sure products among the team.
Oh yeah. And then are there any treatments that you would recommend to clients that would be beneficial to prep before makeup?
Yeah, actually I think dermaplaning is great. It is removing all of that peach fuzz and actually removing a layer of your dead skin. So it really helps brighten up the complexion. Not to mention, everybody's got that little will fuzz on their face. So hope that makeup lay flat is really great. That one's more of like a day-to-day, month.
That's awesome.
Oh, and then I completely forgot. We also are doing the Hollywood Spectra, which is my like go-to now. It is going to be for more your big events, your red carpet. You're like, I really need a reset to my skin. We actually lay down a layer of carbon, and that carbon goes into the pore and blocks away all of the dirt and oils, and really refreshes the skin. It can also kind of help with prepping that skin with anybody who has acne, breakouts, anything like that. So I like to do that one for your, bigger events because it's really that shocking. Wow, the skin looks so good. So
I want to try it so bad.
The carbon laser peel is amazing and it really does exfoliate so great. Obviously, I'm gonna do it a little bit of time before an event because you still feel like you had a laser, treatment. Like it's not painful or any of that. There's no real downtime, but you need a minute. And then that glow is amazing. My pores, I swear, never look so good. So I love that. Amazing. You guys are great. And it is true. I would say that I started actually in makeup in our world. And there's certain things you spend, good money on. Skincare is what you spend good money on. That's the foundation of anything we put on top of it. And obviously we love how our makeup looks, but skincare is the key to everything for sure. I love that.
Absolutely.
Thank you, ladies, for bringing it all together for us.
Absolutely. Thank you, Madison, for talking with me.
of course.
Are you guys ready to learn some makeup?
Let's do some makeup.
Let's do it. So I am going to be teaching you guys how to do a basic smoky eye. Lauren can zoom in here to kind of see what we have going on right now, but I have just a beautiful little smoky eye with some gold glitter, a winged liner, and some mascara, and I'll show you guys how to apply the lashes as well once I'm done. But kind of with what I'm working with here is you're gonna want, when I do smoky eyes, I tend to play with two different brushes. I have this more kind of looser brush and it's more of like a buffer. And then I have one that's gonna be a little bit more compact, that way that you can put on the glitter. And that's how you get away with both of those two different looks.
So your looser brush base is more kind of like a dome brush, right? That we're going to utilize.
Yes.
The other one's a little flatter,
Yes.
for those of us that are new to brushes.
Yes.
Yes.
Absolutely.
Awesome.
And then the palette that I am using tonight is Tartelette.
We love
from
Tartelette.
Tarte. It is the palette that I use with all of my brides. I love it so much. It's got neutral colors, it's got warm colors, it's got cool colors. So really it's a perfect palette for anyone to try anything at any point in time. And the nice part about this makeup look, you guys, is it is suitable for anyone, any age, any night out. You can make it as dark as you want, as light as you want, as colored as you want, as neutral as you want, and that's the beauty of it all. So I'm gonna get right into it for you guys. I've already prepped my skin and I've already done kind of the base. I used the Milk Hydro Silk Primer before I put on my foundation, and my foundation is the Elastin Hydro Tint Sunscreen. And then I did a little bit of blush and contour and highlight, and for my eyes, I already pre-prepped them. The way that I like to prep my eyes is with primer and then concealer and then powder over top. And the reason why I do that is I personally have very oily eyes. And they tend to crease up by the end of the day, that makeup. And so the way that I've noticed I get my makeup to stay a little bit longer is when I put all of that together and create just a beautiful start to that palette. And that is a really good way, if that's something you do struggle with at home, is that oily or it tends to crease and you notice you get the eyeliner on the top of your eyelid by the end of the day. I've noticed that tends to prevent it pretty well. So that's a good way to start with that. And I'm going to go ahead and start my look now. I'm going to use the color Garden. And pretty much what we're going to do is just kind of tap into that a little bit. You don't want a ton of product because you want to build. So you want to start really small and minimal and then start building up that way. So you'll start with a less amount of pigment and then build up to more as you reach the level of pigment that you want. And kind of the way that I start this is I start right at my inner corner and I tap in just a little bit of a circle there, and you build off from there. And I use circular motions to create the smoke, and that's what gives you that very beautiful blended look. And I pull it all the way forward, but you want to leave this whole portion of your eye completely open. That's where the glitter is going to go. So you want to leave this open and really focus on creating a crease within your eye is the best way to kind of explain it. And I'm using those circular motions to really give it a beautiful blend. You don't want any harsh lines when it comes to a smoky eye. There are good days for that and good looks for that, but this isn't one of them. And you just kind of build and you blend, and I'm just keeping an eye on my other eye here to see how I'm doing match-wise. And you just kind of keep blending out. I'll tap back into the powder a little bit. And the next step here is you want to bring it slightly into that crease, giving it that shadow effect. So you're still leaving space here, but you're going to fill in a little bit over here. Sometimes I'll go halfway, sometimes I'll go less. It just depends on the day. And really what you can do, and something that you can do too, if you have more mature eyes, is you can kind of lift your brow up, and that will get rid of some of those fine lines that tend to get in the way when it comes to doing the eyeshadow. And that way you can keep blending and keep getting in all those little areas that may be hard to reach. And that is an easy way to do that. And I'm going to add just a little bit more pigment, kind of just around the outer here. And then the next part of the smoky is bringing it down to the waterline. That's really what creates the smoky look, is that it goes all over the eye and not just in one specific area. So I'll tap back into that powder, and I tend to use my pinky to pull it down a little bit so I have a little bit more control of where that powder is being placed. And I just slightly pull it up this way, and I tend to go about halfway down. And you just keep kind of smoking it out, and you want to blend it up into that little circular area that you created at the beginning. And you just slightly kind of go back and forth, and that's what creates the smoky, the first part of the smoky eye look. Don't get rid of this brush yet. You're going to need it again here in a second, but we're going to switch back over to this one, and this is what we're going to use our sparkle for. The sparkle that I'm using in the Tartelette palette is called Sunflower. It's a really beautiful, it's not a super fine one like Sunkissed, but it is a beautiful glitter, very visible, and you can make it as pigmented or as unpigmented as you want. And for this next piece, what you're going to want to do is you want to come right into that crease. And I tend to focus it just right there, and don't be afraid to get it anywhere else, because the whole point of having that brush on the side is so that you can reblend it back out. So don't be afraid to get it there. And it doesn't have to be glitter either. It can be a lighter shade. It can be a neutral shade, whatever that looks like. I just like glitter. I'm a glitter girl. Can't help
Like the
myself.
sparkles.
We love sparkles, so we're going for it. And as you can see, I just kind of take it and I follow the shape of my eye. And it's okay to get it again up on the top, because that still gives you a little bit of that glitter to work with later. And I just kind of fill in that whole area. So this is where we're at with the look now. Again, if you have more mature eyes, another good way, if you're having a hard time with that crease, is just slightly lifting above that eyebrow, where you can see that lifts up the whole crease of my eye and gives me complete control into that middle center of my eye. So that's a good way to do that. And then you're going to want to get this brush back out, and I dip it just back in the powder a little bit, just the smallest amount, because you don't need much. And you want to just bring that back towards the center. And what that's doing is it's blending the line between the gold and the brown. And so just kind of going back and forth there, and that's what creates the beautiful gradient that happens in smoky eyes. And you just keep kind of going back and forth until you get the gradients that you want. I'm going to use a little bit more pigment because I want a little bit more of a blend there. And I tend to take it just slightly above the eye as well, just to give it a little bit more of a shadow. And then you just keep kind of blending here, but you can see just how blended that looks after you've created. It almost looks like two separate lines, and then you blend it out and it gives it just that beautiful gradient that is a smoky eye. Again, feel free to always pull up and away. That's the best way to kind of get away and get some more control in areas that you may not be able to see. And that's kind of the way that you do the eyeshadow portion of everything. And as you can see, it's very well blended with my other side, just keeping note on going back and forth and doing it that way. I happen to already have this eye done, so I can't go back and forth, but that's kind of the way it goes. And I'm gonna do a very minor eyeliner tutorial because everyone always asks me how I do my winged eyeliner. So I'm gonna kind of teach you guys a little bit. I have to get a little bit closer to the mirror for this one, but the way that I do my winged eyeliner is I start with a little bit of a line, and I got a little bit on the top there, but I'm gonna bring it up that high so it doesn't matter. If you mess up, you can always grab your makeup brushes and just reblend back out. I'll show you guys for the sake of having messed up a little bit. It's super easy. You just kind of retake your brush and just blend it out, and it goes just away. You never have to see it again. That's the nice part about makeup, is it can be customizable in any way that you want it to be, and it's gone. You would have never known that I messed up. Anyway, so you create just a line.
It makes it look so easy. Anyways, we'll just go right back in and it's fine.
Everything is fine. It can go away. And you just create a line, a very small line. You want it to be kind of thin at the beginning so that you can build. It's the same way with the product when it comes to putting on the powder, is you want to build on top of it. So you just keep adding more as you go. Don't start super thick because it's harder to take away than it is to add on. And then this is the part that I feel is easiest, but it's not. You can see on my other eye that I have more of an up wing going on here. So we're going to create that same look on the other side. And the best way to do this is to just kind of keep an eye on where everything's going. And I know that I want this to be right about here. And so I just kind of create that line. And then you fill in that way. And I fill in as I go. Some people fill in after, but I fill in as I go. And you just follow the crease of the eye all the way down and fill in.
They're asking Miss Faith what eyeliner you're using. Is that the Sephora brush tip?
It is. Yes, this is the Sephora liquid liner brush tip. It is the waterproof. I personally prefer this over a felt tip.
Same.
Because felt tips can, like as time goes on, they tend to get little sprouts out of them, or they tend to get dull, and you can't create as precise of a line as you would want with a felt tip, in my opinion. I tend to get more control with a brush tip.
I feel the same way, and I feel like when you're trying to create a wing, I don't know, I feel like you can get a little bit more of that like point. Jenna says you should offer a makeup class. Oh, well, we offer makeup lessons.
We do offer makeup lessons.
But maybe we can do a bigger class as a collaborative to like have some energy. That would be super fun. But we do offer lessons.
Cool.
Yeah.
Absolutely. That would be such a fun idea. But yeah, so you just kind of create that line, and that's how I create my eyeliner look. And then I'm going to go in really quickly with some mascara. Sometimes this can be a little challenging actually. So I can kind of show you guys some tips on how to apply your mascara in a better way. I tend to do it a little bit differently so that I can create a fuller look. And so this is kind of how I do my mascara. Right now I'm using Too Faced Better Than Sex mascara. That's my number one recommendation for mascara. I love the way that it lays. It does come in waterproof, and I use it on every single one of my brides that I do makeup on. So I cannot recommend this mascara enough. And kind of the way that I'll do it is I'll start right at the base of my lash. And starting at the base creates a darker line that gives you the opportunity to blend out the eyeliner that you just worked so hard for.
And you
so
just did a tip that you didn't even share. Do you see how Faith is like putting the brush at the base and like moving the brush a little, or you can spin the brush, but using the brush as a tool, because it is a tool, really makes your mascara go on crazy different.
Absolutely. And I'm using little shimmies, and I like the shimmy because it gets the lashes in between all of those little brushes within the wand. And it gives you the ability to coat the whole lash without having to go back in over the top. I'm personally not a big fan of going back in over the top, just because it can affect the eyeshadow you just worked so hard on. It can affect, it can get you kind of those spots that are harder to remove once it touches the top of your lash and everything like that. And I always go in and do bottom lashes.
The
I can't live
mascara,
without it.
again, is Better Than Sex. I mean, it could be controversial, but we're gonna just say Better Than Sex.
Better Than Sex.
I also like, I'm gonna share one of my favorite brands. I love the Lash It All mascara from Lancome. It's one of my favorites, but I like something that's a little more defining, that's a little bit more lifting. Yeah, you can get Better Than Sex. It's Too Faced is the brand, is the Better Than Sex mascara. You can get it from Sephora for sure.
Yep. And then I'm going to share one more quick tip too. So once you do your smoky eye and everything looks nice and beautiful, with the glitter, it tends to sometimes come down here, and you can kind of see on me that glitter transferred. That totally happens. I personally tend to do my foundation before I do my eyes. So the way that I can go in and fix that is with a foundation brush, which I already put product on. And you can really just kind of swipe that away once you're done with the makeup look, and that will help take away some of that residual glitter or whatever that looks like after your makeup. Another thing you can do is you can actually do your eyes before your foundation. That way you can make mistakes and do whatever that looks like, product transfer, anything like that, and you'll still be able to clean it up and then do your foundation over the top of it. So there's a couple different ways you can prevent that. You can do what I did and take your foundation brush and just clean up afterwards, or you can do your eyes first and then do your foundation and everything else around it afterwards. But that is the completed look. And now I'm going to show you guys what everyone has been waiting for, how to put on your lashes. This is a pretty difficult application, surprisingly. It took me a little bit of time before I was able to master it, but if you guys have your lashes at home, get ready. I will show you the tools that you need.
Get ready. All the lashes.
Obviously, you're going to need your lashes. I recommend the Ardell 422 lashes. They are a natural wispy lash. I love these lashes. I cannot live without them. I get compliments on them all of the time. They look so natural and yet so beautiful. The band itself is very, very small, very thin, and it doesn't feel like you're wearing lashes at all. And it's really incredible the way that it blends with your natural eyelashes. So this is my number one recommendation for eyelashes. I highly recommend it. You can get it at Amazon. Sometimes they have them at Target. Another really good brand that I love besides Ardell is Kiss. Those are really good lashes as well. The way that the band is very small and minimal. It doesn't feel like you're wearing lashes, and especially for somebody who's maybe newer at doing eyelashes, it's a really good place to start. So
I feel like those lashes too, because sometimes like each of our eye shape is very different. Like some of us have more open and some of us have more closed, but that 422 I've seen, like you said, Faith, really looks good on so many different eye types. I could say each of you should know Faith did my face tonight. She did my makeup this evening, and I'm wearing those exact lashes, the 422, so you can see. And I have long lashes, but just gives me a little bit of like Vavoom. And
That's right.
so, yeah, it was beautiful. She did beautiful. I love it.
Yes.
Do those
And
lashes.
I'm gonna do them. So the way that I apply my lashes is with tweezers. You can use lash applicators. I find this to be a little bit easier because it can give me more control for placement. But feel free to try so many different things. You can't go wrong with anything. If it feels more comfortable to use a lash applicator, use a lash applicator. And then I have an eyelash curler for afterwards. I do not curl my lashes before I put lashes on because they tend to be too curly and the glue can stick to the top of your natural lash. So I tend to wait until afterwards to curl them. And you'll want a pair of small little like eyebrow scissors in case you have to cut anything off. And I'll show you how to measure. So let's get right into it. And you'll want lash glue too as well. That's probably important. I should say that. But for lash glue, I recommend either Huda Beauty or Duo lash glue. Both of those are really, really good quality. They stay on for a long time. I've cried and my lashes have stayed on and been to concerts and screaming and sweating and they last the whole night. So that would be my recommendation. So to kind of start with the lashes, I pull it off of the track and I just kind of hold it up to my eye. And the way that I do this on yourself is I keep my eye open, but I tend to look at here. You can see that this lash is a perfect fit for my eye type. The way that it comes all the way to the end of this lash and all the way to the end of that lash, it's going to be a perfect fit. So I fortunately do not have to cut any. If you do notice you have to cut any, for example, you know, maybe my lashes or my eyeballs are a little bit smaller and I need to cut off that much there at the end, I personally always cut it off of the end in place of the inner corner. Just because of the way that the lashes are created, it still has volume on that outer corner. So you can cut that volume off a little bit and still have the volume that you need in order to continue forward. So that is the way you kind of do that. Again, I'm a perfect fit, so we're just going to go right into it. And I'm pulling out my glue here. There's a couple different ways you can apply the glue to the lash itself, but this is the way that I've noticed is easier. I hold it with the tweezers and then I grab the glue and just ever so slightly get the smallest amount of glue out. And you want to follow the band all the way down, making sure you saturate all the way through. And you just kind of follow the lash band and it creates just kind of this darker line like so. And then this next part, this is what a lot of people tend to get wrong, is they want to put it on their lashes immediately after you put the glue on. You don't want to do that. This is fresh glue. If you do that, the lashes are not going to stay. You're going to have a lot of movement. You'll notice some holes where corners lifting, and we don't want that. You want them to last all night. So in order to do that, you want the glue to get a little tacky, which is why you let it air out. I tend to wave it around, I'll blow on it. And you'll notice when it's tacky, when the glue starts to turn less gray. So this is a black glue, which is why the glue looks gray. And you've noticed that it's turned slightly black now, which means that it's tacky and it's ready to put on. So I will grab the lash pretty much by the middle there, and I tend to always place it in the middle first. So then we'll come over here to the mirror and I'll look again at where it's placed on my eye, and I know I'm going to set it right there. So then I'll kind of ever so slightly close my eye and tap it right on there. And then you take this outer corner and ever so gently bring it down and just keep ever so slightly pushing. And then you take this outer corner or the inner corner and you just push it right into that inner corner and just kind of tap, tap, tap. Try not to mess with it too much because you want that glue to dry. But that is how you apply your lashes. I'm going to do one more just so that you can see it again because I know it's a difficult thing. You want to take that lash out. I know it's a perfect fit, so I'm going to go right for it. And again, you want to apply the glue to the band. Oh, it's got a little, there we go. You want to apply the glue to the band ever so slightly. I just press so gently on there and you kind of follow that line all the way through. And you can see just how light gray that is right now. And then I'll show you what it looks like when it gets tacky here, because it's that difference in color really does make a difference. Because once it's tacky, once you place it, it sticks where you stick it in place of it moving around and shifting in different areas. So we let this guy get tacky for a second here. This is the part that takes so long.
Just for to get a little tacky. Everybody says that you make it look easy because you do. Everybody's like, I would blind
I don't know
myself.
what else to say.
It just takes some practice and she
It
can
does
help
take some
you.
practice. Absolutely. And so now if you look at the glue again, it went from that light gray to now a dark gray. And that's a very easy way to tell that it is tacky. If you're using white glue or clear glue, you'll notice that you'll put it on and it'll be white. And when it starts to get tacky, it'll start to turn kind of clear. And that's how you know it's becoming tacky and ready to put on. So we'll come back over here to the mirror again and I'll measure up. I know that I want to place it right there. So I'll kind of close my eye for a second and place. And then go to my inner corner. And then to my outer corner. And just tap, tap, tap it into place. And that is how you apply your lashes.
You do make it look easy. And it is important to know that you only cut the width, not the length, right? So when you're cutting lashes, you only want to cut how like long it is.
Yes.
If the glue gets in your eye, obviously that's not a good thing. That's why you don't want to apply too much glue. You want to like try and keep it where it's a little bit less glue so that it gets that kind of tacky. And then sometimes it catches an eyelash and you just kind of separate it. And taking them off, you can just use a simple eye makeup remover to take them off.
Or two, you can use an eye makeup remover, or you can take it from the inner corner or the outer corner and slowly peel. If you notice that that's not working and it's pulling on a lash and it's kind of hurting, you can take a warm washcloth and rest it over top of your eye. It will soften the glue a little bit and you can peel it right off. It is so easy.
But if you really want to mess with your husband, you should just pull them off right in front of him because
that's also fair.
Hilarious, right? They're always like, what just happened?
Exactly.
Right. Well, Faith, you did an amazing job educating for us tonight. Thank you so much. You are a natural educator. That was an amazing presentation. Marilyn goes, that's hilarious. I'm like, I know, but sometimes I'll take them off and leave them on the mirror too, just for fun, just for like where's these eyelashes from, just Cliffy's laughing at me, but it's kind of funny. Last night, Faith put lashes on me, you guys. Erin had the really glittery ones and I had like these cute butterfly ones. I still have them at home, but thank you for sharing with us. It was so amazing. I love that you did my look tonight and it's absolutely beautiful. Faith also is our bridal specialist here. She does bridal makeup. And if you didn't know, one of my favorite things is that Faith is one of our associate stylists. She is now fully open and will be moving into a new level soon. And Faith is also my oldest daughter. And so it's been an incredible pleasure to have her come on at Facette and join our team and be able to watch her grow and let her work with her mentors. I take a step back in that space, but I just get a front row seat to watching her be amazing in this role. And you've really developed so much. So I love that I get to share that a little bit with you. Oh, thanks, Marilyn. With you. So congratulations. It was amazing. Thank you for sharing with us because we all need help with our lashes. I still just make her put them on me. That's just how and you can have her do that too here if you want. We do that too as well. So
yes.
Thank you so much, Faith.
Absolutely. Thank you so much for having me tonight. I hope that this helped with all of your makeup. And if you have any questions at all, please feel free to message the Instagram or reach out to us and I can reach back out to you and help you with anything that you may need.
Oh, I love it. Oh, and Molly just said, thanks so much, Faith. You did great. And Faith does her hair, and that's even one of her mentors, which is incredible. So
yes.
Love that. Love that. Well, thank you, Faith. We're going to do some giveaways.
Yes.
Now you look all fancy. You need to go out.
I know. Go out and show it off a little bit.
I know. All right. Thanks, Faith. All right. So thank you all for spending the evening with me. We went a little longer tonight than we had anticipated, but I think that's just because, you know, we had some topics tonight that had a few more questions. There's questions about injectables and CoolSculpting and peptides and hormones. It's a lot to condense into that space, and we want to make sure that we give you the information that is the most needed. And so thank you for spending that time with me. Yeah, it was a lot of good stuff. It was just a lot, and I appreciate that we got to spend this time together. I have a few more giveaways, and then I will let you go for the evening because I want you to get your, as my husband would say, booty sleep, which is beauty sleep, and so that you can join us tomorrow night for our in-person. And I would love, love, love to have you join us for that. I get to give away a calligraphy cut to Maria Dreamer. Congratulations. We're going to get you set with one of our calligraphy artists, and that'll be incredible. I have a shampoo blowout with a treatment for Shannon Law, which is awesome. And Miss Marilyn Wright, you get a makeup lesson with Faith. I feel like that's one of the things that we, honestly, people ask a lot, but we have these makeup lessons. And tonight, you know, we learned, this is an amazing thing that we get to learn too, is that you all asked for a makeup class, and now we can make that happen. We can create something amazing, because I think that would be something that's going to work. Our favorite lashes, we have a full set of the favorite lashes that we talked about, the Ardell 422. So I think there's 4 in a pack, and that goes to Marilyn on the iPhone. That's all it says to us on this side, so we'll have to figure that out. Maxi Brow, which is an amazing product that helps grow lashes and brows, and that goes to Allison Weidman. I have one of my favorite things, gosh, you guys, I have so many favorite things. It's ridiculous, but is a satin set that we offer that is a satin pillowcase, a satin eye mask, and a satin scrunchie, which all of those things are good for your hair and your skin. And that satin set goes to Kim Williamson. Welcome. I have, I'm going to talk a little bit about our sponsors. We have some amazing sponsors, and one of them is Impact Chiropractic. My really dear friend, Elise, owns Impact Chiropractic, and they just do such an amazing job of taking full care of the whole family. Truly, they do everything from infants on up when it comes to chiropractic, and they put a special card for your initial session in our swag bags, and then they donated this amazing impact bag that has a Stanley cup, a cute coffee cup that says this may be wine in it, a massage ball, an ice and heat pack, massage oils, and t-shirts. It is like all ladies all the time in this bag, and that goes to Holly Dykstra. I have Taryn Stenson. She was on here tonight, and I hope she still is. From Country Financial, came on as a sponsor, and she made a great connection with our esthetician Jenny, and we're doing some cool collaborations with her. But she donated for our swag bags, and she also donated this she made this really beautiful kitchen basket, and so that goes to Nicole Fleming. So congratulations, Nicole. It's the cutest basket. I had to hide it from everybody. And then I have a swag bag, one of our famous swag bags for Mandy S. And that is for you. And last but not least, I have a $50 Pilar gift card. And I want to just put a shout out to my friend Anna, who owns Pilar. She picked this little shirt for me. She like be cute under a blazer or on its own, and so I love that I got to wear it for tonight. But Anna is absolutely incredible. One of my favorite moments was I was transitioning my closet, and she put together a whole styling for me where she picked all the clothes, we talked through what I liked, and helped me like try them on and see what fit. It was the best time I spent, and really helped me get really quality clothes. And so I have a gift card for Renee Parator. That's for you. But in the chat is the link. If you want to do a personal styling session with Anna, it is well worth it. I just want you to know from my perspective, something that is worth the investment in time when you're really wanting like some help with your style or to change it up. For me, I felt like I got kind of boring in my style. It was time for something new, and she always finds me some amazing things that just keep me feeling fresh. So I love that. Also tomorrow night, our other sponsors that we collaborated with were Get Plattered. So we're gonna have some amazing charcuterie from them. We love our NOCO Colorado We Hang lights. Our building looks so beautiful, the lights they put outside so that we can celebrate this weekend. And just super excited. We have some fun things to share with you. Probably maybe a 360 photo booth. So we're gonna have all the fun tomorrow night and even more giveaways. And that's what we love. Please don't forget that we're partnering with our nonprofit, and giving back to them is an important part of our week to make sure that we help them feel successful too. So without further ado, and thank you again for spending the majority of your evening with me, even though it's later than I anticipated. I'm kind of a night owl, so I'll just keep up all night. Just kidding. But until tomorrow night, we're going to go live tomorrow night when we give away our grand prize. Christine English is on here with us tonight, and she won last year. And it was fun to have her be present and be able to see her face when we were able to give her amazing prize, and well-deserved. So it was super fun. No, thank you guys. It was a fun night. I love being able to share with you. So until next time, tomorrow, I hope you sleep well and that you have an amazing evening. Thank you all so much for all your love. Appreciate you all. Good night.